How can a wounded person recover while receiving ongoing damages?
Okay, welcome to Bridges Not Walls. I am your host Zenwei, and today we're gonna be talking about health and mental health. I also spent about 3.5 years in the mental health industry, and I have a little bit of a background in psychology as well. Today we're gonna have two wonderful guests on my left here. We have Dr. Chai and also we have Moses.
My name is Dr. Chatichai. By profession, I'm a medical doctor. Of course, I'm doing something else. I'm doing tech and recycling industry. The passion for medical goes deep into me ever since I was in KKM, and now I'm also still serving as a governing board member in Malaysian Red Crescent Society in the health and training portfolio. I do a lot of work when it comes to outreach programs for the refugees to benefit not just the refugees, of course, but the orang aslis and also the vulnerable communities.
Moses, and I've been here in Malaysia for 13 years. So I'm a refugee from Myanmar. Right now I'm working as a teacher at a refugee school. Before that I was in a local NGO. It's an NGO that helps refugees with mental health issues. So I was there translating, I was there overseeing a couple of patients with regards to their mental health.
Yeah. So the first question we have is really that why do they get free access? Why do they get all these different healthcare benefits and stuff like that? While we as taxpayers, we are the one funding all this, why should they get all this, right? But can you help us, unpack this, right? Why is that not the case, right? Because I know for a fact that, from previous conversations, a lot of this is actually not accessible to them, right? So what is the reality here, right, when it comes to healthcare access?
As you know, in Malaysia, healthcare is subsidized, fully subsidized, where Malaysians have to pay 1 ringgit for general doctor visit, and also they have to pay 5 ringgit for a specialist visit. When it comes to the perception of whether healthcare is free for refugee or not, I think it boils down to the same perception when it comes to refugees are buying our subsidized item, like minyak masak terpakai, used cooking oil, or subsidized rice and stuff like that. So when it is put into the consumerism mindset, general population will think, hey, the refugees goes to the doctor also, they get the subsidized price, which is true and not true. Because when a refugee goes to the Malaysian government hospital or private government clinic, they do pay full price, but it's still subsidized as compared to if they go to the private sector. It is still a full paying price. We always call it FPP, full paying patient. They'll be penalized with a heavy deposit, depending on the ward that they're going. If they're going to a gynae ward, it's 2.5k. If they're going to orthopedic ward or surgical ward, it's about 3k or something like that they have to pay upfront. So many people don't really know that, because we as Malaysians, when we go to the government hospital, we don't see this bill. We at the end of the day, we see 1 ringgit. Of course, if you look at your bill extensively, none of us actually do, you will see there's a lot of pricing going in there. Subsidized by government, 1 ringgit. If you are 65 years and above, subsidized by government, 0 ringgit. It all boils down to medical education. How many of us actually look at our shopping lists so often, and how many people actually look at our doctor's listing?
It's interesting because, even with the recent petrol subsidy, like My Budi, for example, if you print out the receipt, right? So if you look at the pump price, it says 50 ringgit, for example. But if you look at the receipt itself, it says subsidize how much, and then the final price is so it's a similar situation in the medical bill. And Moses, actually, you mentioned that you were overseeing, some patients, when it comes to navigating the healthcare access and stuff like that. Let's say, for example, I'm following somebody that really needs some medical help or mental health help. What does that look like?
I would always be with another healthcare provider, or rather a professional, counselor or psychologist. There will always be that one person and myself there to bridge the gap between the patient and the professionals. Where I was in this organization, we have refugees coming in. They don't work in. What they do is there will be people who contact the organizations. It can be community leaders, pastors, whatnot. That there's someone with mental health issues, and that has to be taken care of. If it's urgent, then we will advise them to bring to hospital straight. If not, then we start with all the way from the beginning, clocking and whatnot. So the professional staff will do that, where I'll just help to translate for. So from there, we start the treatment that will include counseling and whatnot to help them. If their mental health is too extreme, then they might need medication to stabilize. They might need injection. Sometimes when they relapse, this organization, we don't have that capacity to take care of the emergency cases. So we'll just accompany them, bring them to hospital to stabilize.
Right. What are some of the challenges along the way?
The word I would use is the best outcome. Okay, so not all diseases you need to treat. For me, it's the best outcome. You look at the health perspective, you look at the social perspective, and you look at the socio-economical perspective. So if it's too expensive to do something, if I don't do it, die or not. So that is what I always think. So when there's a patient that comes to me, I will say, okay, if you can go this route, this will cost this and this. You can also go this route, it will cost you this and this. You can do anything. It will damage you to a certain degree. Whether you become an invalid or whether you become OKU or not is a different story lah. But always I look at the challenges in the different route. So obviously it boils down to number one will be money. If it's physically damaging you, but it also monetarily damaging you and your entire rest of your family, that's where I feel that I have to advise to decide. And that's when refugee communities or even poor people in Malaysia, sometimes they cannot express that. They say, I just want to save my father. But I say, if you save your father today, your whole family will be condemned for the next 5 years because of how much they have to fork out, how much money they have to fork out. So for me, the biggest challenge will always be choosing the best route for the certain situation. Of course, medically and socio-economically. So I think when it comes to caseworker also, that's the thing. So the caseworker will come to me sometime and say, Dr. Chai, I got this. Then I say, this one mahal, expensive. This one very expensive. Please try to counsel them to not do that. Maybe you have a broken hand. Instead of operation, just put a cast. You put a cast, of course, sure, his hand will be a bit sangat. Is he a breadwinner for the family? If he is a breadwinner for a family, okay, fork out as much money as possible to operate. But if he's not really a breadwinner of the family, then sometimes you have to put into perspective, he can live with a sangat hand for XX amount of time, and it wouldn't be a problem. Then when you go into the counseling to the family, that is the problem, I feel. That they sometimes refuse to look at other aspects of the situation and just focus on the medical part.
Whenever it comes to healthcare, it is obviously commonly known that it is expensive everywhere, right? So what more in a situation where this is a full price paying patient, right? Right. I think the hardest part for caseworkers is really to kind of make sure that the reality is accepted, right? And you make a timely decisions as well, right? Because sometimes when you delay and they cannot decide, and that may actually make things worse as well, right?
I think from a refugee perspective, there's a wide range of challenges that deeply impact their well-being. So that would be during their displacement and resettlement. And then I don't think I can do justice to open up all the struggles they face. But I think there are a few that we can see that often come across of different refugees. There will be safety and security concerns, their livelihood difficulties, and then acculturation challenges or problems like language barrier, and then harder to access to services and so on. I think those are the problems we're seeing with refugees.
Yeah, you mentioned about safety and also like incarceration, right? Maybe you can share in terms of like what does that look like, right? Because we go to a clinic as a fellow Malaysians, like okay, I have a broken hand and stuff like that. You get it done, you walk out, that's it. But here you're like, okay, I can't work, but it's really, damaging to my well-being. But I just can't go there because I also need to think about like, would the authorities do something to me? Will I be reported? Will I be deported and stuff like that? What if I'm taken away? What does that look like?
In healthcare setting?
Yeah, in healthcare setting. Yeah.
You have two types of healthcare setting. You have the healthcare setting where, government hospital, for example. So when I used to work in the government, I was some sort in management in Sarawak. So we have a lot of uncollected debts, right? Okay, we have a lot of uncollected debts, even for Malaysian, even for refugees. So it is our KPI to collect back the debts. So it depends on, at that moment in time in life, you feel like, can I take this debt or not? So if you can take this debt, then you have to please pay the deposit. And you are very stringent about paying the deposit. So that is one factor. And then you also look at the disease. And everything is just estimation. ONG cases, we will say 2.5K upfront. You might use it, you might overblow it. Surgical cases is 3,000. You might use it, you might overblow it. But whatever we do is we will put an upfront cost to it lah. So I think it boils down to the same thing when you go to a private hospital. You got insurance or not? You got insurance? Whack. We save you. We bring heaven and earth. We call God to come and shield you. Everything we will do. But if you got no insurance, then we will be a bit reserved. So I think it boils down to the same thing when it comes to refugees. We will always ask for a deposit. And if you cannot fork out the deposit, it depends on the person on duty whether you want to help or not lah. But when it comes to emergency cases, regardless, we go all out. When it comes to something where we call code blue or something in a patient collapse, then we will go all out regardless of the status of the payment or the deposit status. But it's a bit tougher for them because there's always that lingering factor that this person will owe us money. And if this fellow owes money, he can pay or not.
So it sounds like it also depends on the institution or the medical place that you're going. And in terms of like, you mentioned about the place that you're working with, you also need to look at the financial health, whether you can take the hit.
Correct.
Right.
Correct.
If I can take the hit, obviously it will appear as more welcoming in a sense because they are in a position to be able to take on those financial risks, right?
Right.
If it's a place where it's really highly utilized and like it's already not in a financial okay place, then therefore it will seem like it's more strict and less welcome.
We do have a location for a hospital lah. So whether you can take the hit or not lah. So some hospitals overutilize their budget, burst their budget in June, budget end of the year, June burst.
Right.
I really cannot take the hit. I really cannot. So I will come out with a directive to my workers, to my staff, to my colleagues. Guys, we cannot take the hit if you can take deposit upfront before we do anything. Sometimes when it comes to January 18 lah, still got money ma. It also boils down to the individual, whether they are more welcoming or they are not welcoming. There are people that actually are welcoming in our healthcare system, and there are people that are not welcoming at all lah. So that's why in KL we always have places which is refugee-friendly hospital.
Moses, I think maybe you can share maybe one person or one story that you remember that you had to help, right? What they need to actually overcome the challenges, because we wanted to understand, like from their perspective, like what does it take to recover to good state of health, right?
Or something that has impacted you lah in helping them, and you feel that this challenge was a blocker for them having their full wellness.
So in Malaysia, we have refugees who have, when they have their UN card or the UN protection, they're already given, in government hospitals, they're given, I think, 50% discount of foreigner price. And we also have a couple of refugees who are waiting to receive the UN protection. So, like, they just register and they're waiting for the UN to approve or register them in the system. So we have these two group of, I'll say, refugees. The first thing you ask if they have to access to, say, government hospitals, the first thing is, do you have UN card? Because that firstly is for safety. If you don't have that, first thing for this, the challenge would be financial difficulties. Second would be, I think back when I was helping, the doctors or the nurses had to first inform the police in the government hospital that they have to get this police report done to treat this certain people. So that kind of security concern. So, well, how do they overcome this? When I was back in this organization, we try not to get these community members, some of them without UN card. So we try not to get reported to the police. We try to negotiate with the nurses and whatnot. Some cases were okay. Some we had to do it. The nurses said that it had to be done in order to treat. Then we try to get to know whether this person will be arrested or not. And when they say that it won't be, then we continue. Things like that.
You highlighted something really, really important. In order for you to continue to be treated, you had to report to the police and you need to talk to the person that say, like, will this person be arrested or not? And that is something that I don't think a lot of Malaysians know. It's not as simple as, do you have the card or not? It's also, when you do not have the card, then it's also thinking about, like, will you be taken away? And like, if they already said that they're not so friendly, like what Dr. Chai has mentioned, then what do you do, right?
reporting to police is actually not the healthcare role. So if it does happen, it's on the individual.
I see.
Because as doctors, we should and we must only report police if we feel that there's a situation where there's negligence or minors. So we feel there's something done wrong negligently to the minors, we have to report, or the foul play. Other than, I think, socio-economical status and refugee status and citizenship status is not in our jurisdiction to report. But if they do, it is individually. As a Malaysian.
So in mental health, we also want to touch a little bit about mental health, right? How does the community think about mental health, right? Is it something that matters to them? Is it something that they're currently struggling with?
I'll say that I think mental health is often inferior to physical needs and health. They put mental health like a secondary to physical health. If you have headache, you have stomach pain, they would seek doctor's help. If you're stressed or depressed, feeling lonely, but they might not look for doctors or they might not look for healthcare professionals to talk about it until it gets really worse. Then they will start to look for somebody to help with. I'll say in the community, mental health is not a priority compared to their physical well-being. Instead of looking for professionals' help to deal with stress, depression, anxiety, they will first look for someone close to them, their family members or their pastors. Sometimes I think in the community where I am, mental health is seen as a weakness, something that's taboo, in a way restrict people to open up about mental health.
How does that show up in their lives, right?
I think this question illustrated one of the major problems with refugees. So it's how can a wounded person recover while receiving ongoing damages. So many refugees suffer from trauma, but they're able to recover if the environment is restorative. But if the recovery is very hard, when a refugee also have to suffer from ongoing stresses. I think we call this post-migration stress. So trauma shakes their worldview. They do not know what else they can expect or trust. Every waking hours, every air they breathe in reminds them of more uncertainty and potential worries. And you cannot go on street freely. You cannot register a phone line. Your job is at risk. You don't know the languages and have trouble to settling in. It makes it harder to access public facilities and so many more. So when traumatic events and post-migration stress, what they do to each other is they magnify both. So I think the result is they experience a range of psychological distress. It shows up as stress, anxiety, depression, suicidal, and PTSD, and even psychosis. It affects their lives. They cannot sleep. The minds will not stop. They cannot focus. They become easily angry. This is how it shows up in their lives.
What have you seen that works, right? Because you've also, with Young Lives as well, you are part of the education, you're part of the awareness. You've probably seen things that, works well, and it's also like a situation where, hey, this helps you to live better here as well, right? Because since you are here already.
Okay, I'm traditional. I studied in Russia. Mental health was a weapon in Soviet Russia to penalize people that are against the state. And we call them crazy and they go to asylum. Yep. So, but generally, it is environmental. I feel it's very environmental. So for the refugees in particular, they just came out from a huge problem from their country. Escaping war. And they came here and then there's another problem. So when you have that endless problems after problem, that train of problems, that's when you actually go down. Maybe at first when you're a bit young, you can fight it out, and then as you get older and then you feel that you have exhausted all your resources, that's when you go down the spiral drain of psychosis, depression, PTSD, and so on and so forth.
Yeah.
I feel what works is environment. And the environment in Malaysia, even for us Malaysian, is not very well. You come out your house, you jam, you stress. You want to go home, you think twice, you come out, you jam, you stress. Now I can't even remember where I park. It's just so mentally taxing for all of us. When it comes to refugee, it's just that the environment, to make that environment healthy for them to thrive. And when they don't have a supportive community, in the refugee community, you see there's a lot of community that we work in. There are some communities that are just so supportive. One down, they raise 20,000 just like that. Some communities, one down, 200 ringgit also cannot get. There are certain communities that are just so tight-knitted where they feel that if they are down, everyone can find money. Of course, it boils down to the agenda of the why we're raising money. But to make it work, the community must be tight and solid. I think it boils down to us Malaysian also. I think the first time you had your first job, you feel you had no friends because your high school friends are gone. Now you have to find new colleagues, and these new colleagues are different key, different sing. You need a support group.
Yeah.
You always need that support group to bitch about your bosses, to bitch about your colleagues, to bitch about your work. If you can have that outlet, it's fine. But when you have a problem in a community and this problem you go and tell people and they say this is a taboo lah, why you crazy? Small thing only ma. That's when your mental health will stumble down the rabbit hole lah. So it's all about the community lah, which I feel that the refugee community in Malaysia are lacking. Because number one, I also got my own problem. Why I need to care about your problem? So when people are selfish, that's when everything becomes worse lah. So what works? Environment. How do we get there? I don't know.
I think the community aspect comes out very strongly. Everybody that we've spoken to, either the refugee youth themselves or refugee educators themselves, I think they also come out to say that actually that's what keeps them going. And you can definitely see a lot of bright spots where they are definitely very they're trying to help each other out more and stuff like that. And the fact that you mentioned that there's some communities that are actually thriving better because of how well they cooperate, that's where I feel like in terms of us as Malaysians, that's where we can come in. We can show them the path around what can actually work better here in the environment they're in, given the circumstances that they have.
We can just be friendly with them and they can immediately they feel okay lah.
Yeah.
This place is not too bad.
Not too bad, yeah.
Not too bad. Then that's where it starts lah.
Yeah. I think what Moses mentioned is very important in the sense that how can somebody recover if they continue to receive damages, right? If you already have a burn and you need to keep going to very hard hazardous environment, it's very hard for the burn to heal, right? So I think for us, to our best ability to be friendly and to provide that empathy I think it's the bare minimum that I think all of us can have, right? The odds are already stacked against them. There's already so many things that they need to think about financially speaking. But to have financials, you need to have job. But to have job, you need to have this, you have to have that.
Security and stuff. Yeah.
Everything feels like it is an uphill battle. Yeah. So the least that we can do is to actually make things less difficult. I want to thank both of you for sharing your perspective, and to Moses, I want to thank you for you being a teacher to the community. I think it's super important, right? So it's a way for us to actually show them that things can be better. In such hard situation, it's very easy to be selfish, but you decided to not be selfish. You decided to help, and you decided to step up as well. And I want to thank you for that perseverance and grit as well. Yeah, thank you so much for being here.
Thank you, no problem.